All right, let's dive into measuring blood pressure the old school way, by hand. It's a critical skill.
But are you positive you're doing it right? Because one tiny mistake can throw everything off.
So, first, let's talk numbers. Systolic pressure, that's the top one, when your heart is beating.
And the bottom number? That's diastolic pressure. It's when your heart rests between beats.
Okay, let's get into it. Proper prep is absolutely key for an accurate reading.
So you'll need a stethoscope, and this is huge, the right size blood pressure cuff.
Now, on to positioning. Honestly, you can't get an accurate reading if you mess this part up.
Make sure they're sitting with their arm right at heart level, and hey, no crossed legs.
Your first mission is to find that brachial artery. It's right there in the bend of the arm. Now wrap the cuff about 2 inches above that bend with the arrow pointing to the artery. And now for the most important part, the 2-step method. This is the secret to accuracy. So why 2 steps? It's all about avoiding something tricky called the auscultatory gap. Think of it as a weird silent spot that can completely fool you into a wrong reading. First, just estimate. Feel the pulse, inflate the cuff, and know when that pulse disappears. Got that number? Okay, just add 30 to it. That's going to be your new target. So, for example, if the pulse disappeared at 100, your new inflation target is 130. Easy. Now, give the arm about a minute to rest. Then you're ready for the real thing. Gently place your stethoscope over the artery and pump that cuff up to your target number. Now, let the air out nice and slow. And listen, really listen. The very first thump you hear, boom, that's your systolic number. And the exact moment that sound goes away completely, that's your diastolic. So you've got your reading, let's say 104/78. But what does that actually mean? Well, these 2017 guidelines are basically your decoder ring for the results. This chart shows you exactly where that reading falls on the health spectrum. Super clear. And you're not done yet. Fully deflate the cuff, remove it, and write everything down. See? Getting it right isn't just a detail. It's the key to truly understanding your health.